I think the most exciting thing happening today in cancer is the PD-1 antibodies and the checkpoint inhibitors using the immune system to fight cancers. There's been some outrageous data in lung cancer now presented in all other kinds of tumors that have just shocked and surprised people. Where we didn't think it was going to work, it's doing unbelievable things. Florida Cancer Specialist is unique in the fact that it combines more academic medicine along with your community oncologist. It allows us to do a lot of research, the stuff that I really wanted to do, using newer drugs, using cutting-edge therapies, using clinical research trials in the community setting. So we're bringing, revolutionizing medicine to the community setting years before most communities would be able to see it. The clinical research side of it, when I was in fellowship, I was very involved at University of Alabama, Birmingham with the people that did the phase 1 research, phase 2 research trials. My mentor was the director. So I came into private practice and it was very eye-opening to me about how much was available. And then I developed my practice to the point where I was comfortable opening trials and starting to become what's called a primary investigator. So I've now started opening different clinical trials in lung cancer and prostate cancer and bladder cancer, and moving forward with a lot of the newer treatments, these antibodies that are using your immune system and checkpoint inhibitors. It's just a very fascinating field, and being able to bring that to patients years before they're FDA approved is good and important. The partnership with Sara Cannon and Florida Cancer Specialist is very unique and very important. It allows us to bring cutting-edge medicine to hometown quality care. So we care for you on a daily basis. You see us, you see your doctor, you're in your hometown, you're not having to travel, but yet you're still getting the medicine and the drugs and the new drugs that you would get at a Moffitt or a Johns Hopkins or an MD Anderson. We are very well competitive in the clinical trials with them and what we have offered our patients. So you do not have to then travel to get state-of-the-art medicine. You can get it right here in your hometown. I actually thought I'd be a cardiologist, but did my rotations in my internship and fellowship and internship and residency in hematology oncology, and it would just fit me. The patient population, the problems they had, the family discussions and the interactions you had. It was more personal. You have to communicate as if you're treating them as your family. I always say that if my mom walked into a doctor's office, there's a certain kind of respect I want a physician to give them. Well, I can't ask for that unless I give all my patients that same respect. I try to really, truly treat them like my family. I give out personal information about myself. They're allowed to get a hold of me personally. I will reach out to them as if they're my family member and their family members. I also give out my email address to families. I'm available for them almost any time. I also give a lot of compassion, and I do listen, and not that I don't think anybody else does that, but I truly do think I'm different.